If you're a woman in your 40s or 50s dealing with low back pain and finding it harder to stay active, exercise consistently, or do the things you used to enjoy, this video is for you. Many women entering perimenopause notice more stiffness, more aches and pains, and low back pain that seems to come out of nowhere. They often tell me, I feel like I woke up with a different body. If that sounds familiar, you are not imagining it. The good news is that low back doesn't have to define your future, and there are practical steps that you can take to start moving better and feeling more confident again. In this video, I'm going to walk you through the most important low back pain steps that can help get you back to the active lifestyle that you want. Let's get started. Why does low back pain feel different during perimenopause? One of the biggest frustrations that I hear from women in perimenopause is that the things that used to work don't seem to work anymore. You may have exercised regularly for years. You may have always been active. You may have never struggled with pain before. Then suddenly your back starts hurting. You feel stiff when you get out of bed. Your recovery takes longer. Your energy isn't what it used to be, and you start wondering what's going on. The reality is that hormonal changes can affect muscle mass, recovery, sleep quality, inflammation levels, stress response, and overall resilience. That doesn't mean you're falling apart. It doesn't mean you're getting old. And it certainly doesn't mean you should stop being active. It simply means your body may need a different approach than it did 10 or 20 years ago. The goal isn't to fight your body. The goal is to learn how to work with it. Some common mistakes that keep pain hanging around too long. When low back pain shows up, many women make one of two mistakes. The first is doing too little. They stop exercising completely. They stop walking. They avoid activities that they enjoy. And they become afraid of movement. The second mistake is doing too much. They push through severe pain. They try aggressive workouts. They bounce from one internet exercise to another, hoping something will magically fix the problem. Your body responds best to consistent, gradual progress, not complete rest, not all-out intensity. The sweet spot is somewhere in the middle. What are the first steps to take? If you are currently dealing with low back pain, here are the first steps that I would recommend. Step 1, try not to panic. Pain can be scary, but pain does not automatically mean serious damage. Many episodes of low back pain improve with the right combination of movement, activity modifications, and time. Step 2, identify movements that clearly aggravate your symptoms. You don't need to avoid them forever. You simply want to reduce irritation while things calm down. Step 3, stay as active as possible within your comfort level. Instead, we often want movement to be part of the recovery process. Step 4, focus on what you can do instead of what you can't do. That mindset shift can make a huge difference. How can you start moving again safely? Walking is one of the best places to start. It's simple, it's accessible, and for many people, it helps reduce stiffness. If 20 minutes feels overwhelming, start with 5. If 5 feels difficult, start with 2. The goal there is consistency, not perfection. As your confidence grows, gradually increase your activity level. Remember that movement is information. Your body is constantly giving you feedback. Pay attention to how you feel during activity and how you feel afterward. Some mild soreness can be normal, but sharp increases in pain might be a sign that you need to scale things back temporarily. The goal is not to avoid all discomfort. The goal is to build capacity and confidence over time. Once symptoms begin improving, strength becomes incredibly important. Strong muscles help support your body and improve your ability to do the activities that you love. This doesn't mean spending hours in the gym. It means gradually building a stronger, more resilient body. Strength training is especially important during perimenopause because women naturally lose mass as they age. Building strength isn't just about preventing pain. It's about maintaining independence. It's about hiking that trail, keeping up with your family and friends, taking that trip, playing with your grandkids, and feeling capable in your own body. The stronger and more confident you become, the more options you have. When should you seek professional help? Sometimes back pain improves on its own. Sometimes it doesn't. If your symptoms are lingering, returning repetitively, or preventing you from living the life you want, it might be time for professional guidance. The truth is that every person is different, every body is different, and every situation is different. A personalized assessment can help identify what's contributing to your symptoms and what strategies may work best for you. Instead of guessing, you can start following a plan that's designed specifically for your needs and goals. One thing I want every woman watching this video to understand is that the goal isn't simply reducing pain. The goal is maintaining an active lifestyle for years to come. The women who do best are usually the ones who stay consistent. They keep walking, they keep strengthening, they keep moving. They stop chasing quick fixes and focus on long-term habits. And they learn to trust their bodies again. Your body is incredibly adaptable. It can become stronger. It can become more resilient. And it can support the life you want to live. If you're a woman in your 40s or 50s dealing with low back pain and feeling like your body has changed during perimenopause, you don't have to figure this out alone. Many women tell me they feel frustrated because they want to stay active, but low back pain, stiffness, aches, and decreased confidence in their body keep holding them back. My passion is helping women navigate these changes and get back to doing the things they love. Whether it's walking, hiking, exercising, traveling, gardening, playing with your kids or grandkids, or simply feeling stronger and more confident in your everyday life. The goal isn't just to reduce your pain. The goal is to help you move better, feel stronger, and get back to living an active life. If you're ready for something different and you're ready for change, I invite you to book a free low back pain assessment. We'll talk about what's been holding you back, what's contributing to your symptoms, and what steps you can take to start moving confidently again. You deserve to feel strong, capable, and active again. Remember, the goal isn't just to have less back pain. The goal is to get your life back, to feel strong again, to trust your body again, to stay active through perimenopause and beyond. And if you'd like help figuring out your next step, book your free assessment today. I'd love to help you get back to doing the things you love.